And welcome back. Obstructive Hypertrophic Cardiomyopathy. It's a chronic and progressive heart condition dramatically impacting quality of life. Characterized by the thickening of the heart muscle, this condition can restrict blood flow and lead to symptoms such as shortness of breath, chest pain, fatigue, and even fainting, especially during physical activity. Joining me now to share more is the board-certified cardiologist, Dr. Payal. We've got Dr. Payal Kohli, and I should say Payal Kohli, and then we've got a patient and pickleball player, John, who shares with us. And Dr. Payal Kohli, thank you so much for being with us. And when we talk about this here, it's an uncommon condition, but then yet in so many ways, a lot of people are dealing with this.
You know, what's interesting about this condition, Darren, is it's called the great masquerader because it tricks patients and it tricks doctors. In fact, there's some estimates that tell us that 80% of cases actually go undiagnosed or underdiagnosed because of the way that the disease presents. So that's why John and I are here today working with Bristol Myers Squibb to really raise awareness about this condition, which is called Obstructive Hypertrophic Cardiomyopathy. And essentially, it's a genetic condition, which means that it causes structural changes in the heart. So the heart is a pump that pumps blood to our body all day long. And instead of being like a water balloon, if the heart becomes like a lead balloon, it becomes stiff. It doesn't fill normally with blood. And that's one of the problems in obstructive HCM. And the second is that as the blood is trying to leave the heart, the hallway that the blood uses to leave the heart becomes thickened as well. So the blood has less room to get out. So as you can imagine, when you exercise, you can feel faint if it's not getting to your brain, if you can feel short of breath or have chest discomfort. So it's really important to know what the disease is so that you can really try to treat the condition.
Yeah. And so when I'm looking out there and I'm saying, listen, I got to be aware of some certain symptoms. John, let me bring you in for a second. How quickly did you become aware that you were in this condition?
So, I've always been an active guy. I played college tennis, and so that was really an important element in my life all along. And my oHCM symptoms started in my 50s. I started becoming dizzy and felt faint, and I couldn't go on walks anymore. I even switched from tennis to pickleball, thinking it would be an easier sport, but I couldn't even finish a match. So my symptoms continued to interfere with the things that I enjoyed the most, and that's being active. I saw a cardiologist about 3 years ago after experiencing these symptoms, and I was then diagnosed with oHCM.
Yeah. And for yourself, how has it changed your day-to-day life?
Well, after I was diagnosed with oHCM, my cardiologist prescribed a drug called Camzyos, and after a few months, I noticed a real difference in my symptoms. I could even play pickleball again. And so while others, may experience different results, I talked to a doctor, was properly diagnosed, and Camzyos made a big difference for me and my symptomatic oHCM.
Yeah. Dr. Kohli, a little bit more about, once being diagnosed, as John mentioned, there are treatments available.
Yeah, and it's really important to treat them so you can get them back to their life. So surgery obviously is an option where you can actually cut out the part of the hallway that's narrowed, but we usually reserve that in cases where people don't respond to medications. And so we start with medications like beta blockers, which slow down the heart rate. So they allow more time for the blood to get out. And if somebody's not responding to that, then we think about medications like Camzyos or mavacamten, which is a medicine that decreases the force with which the heart contracts so that it basically prevents the heart and the hallway from kind of collapsing on itself as the blood is leaving. And as you heard from John, patients can have significant improvement in their symptoms with this. But while they're on this medicine, because it decreases the force of contraction, it's important to check on their heart, make sure it's not getting too weak with echocardiograms or ultrasounds to keep an eye and make sure they don't develop heart failure.
Yeah. John, for yourself, I mean, you talked about being that tennis player that actually, some people will say upgraded. They won't say downgraded. They'll say upgraded to pickleball. As you upgraded to pickleball, talk to me about that transition time. How long before you were able to really get back to swinging?
After I started taking Camzyos, it took a couple of months before I started to, reduce the symptoms that caused me to, interfere with my activity. So it does take a few months for me, a couple or 3 months to feel better. But after I was on the medication, it really made a big difference in my ability to play not only pickleball, but just take long walks with the dog, just be active again.
Yeah. Hopefully we'll see you on ESPN with some highlights or something. You know, never know. Hey, it's out there.
You never know.
You never know. Listen, let me ask Dr. Kohli, when we talk about genetically, because we understand that this is, this is also genetics is involved here too. As a family member, what should we be doing? How should we be looking at and approaching this, oCHM?
Yeah, so the thing is, if you have a family member who has it, your risk is much, much higher. You get a target sign on you. And I'm not just talking about your generation or the generation above. You really want to look back 3 generations to ask if anybody has it. But even in those cases where you don't have a family member, you can get a spontaneous mutation. So your DNA can just kind of misbehave on its own, and you can develop a mutation. So it's not that you're kind of in the clear if you don't have a family member who has it, but certainly if you have somebody who has it, your risk is much higher. In fact, we screen patients who have family members that have had obstructive HCM. So John's, siblings and his children, we would screen them if we knew that he had obstructive HCM. There is genetic testing as well, because it's a genetic condition. But again, we don't know all the genes that cause it. So we know some genes that cause it. So if the genetic test comes up positive, then we know that you have a bad gene. But if it comes out negative, we still keep our radar up, because it's possible you have a different gene mutation that we haven't yet identified.
Right. And then we hear the word obstructive, and when somebody says obstructive, that's very serious. How do you break down the word obstructive for the average viewer that's out there watching, saying, listen, unpack this for me because I really want to know more?
So obstructive means there's an obstruction to the blood leaving the heart. So I want you to think about your garden hose, right? You're watering the plants, and then all of a sudden you put your finger on top of the garden hose, and that water can't get out. So the pressure inside the hose really starts to build up, and it starts to back up into everything. That's what HCM is. And then you turn the volume up on the water while you're exercising, because more and more water is coming out, but none of it can get out. So that's what obstructive hypertrophic cardiomyopathy is. That there's an obstruction to the blood getting out of the heart, to getting to the organs where it needs to get to, which doesn't just cause problems with the organs because they're not getting the blood, but it also causes problems with blood backing up, increasing the pressure inside the heart, causing electrical problems with the heart because of that, causing structural problems with the heart because it's stretching out all the chambers. So you can develop heart failure, you can develop arrhythmias like sudden cardiac death, and you can obviously develop the symptoms as well.
Yeah. John, what is it that you want people to know before we go? Is the message is being shared a little bit more about, not just disease, but also to be able to, the ability to overcome?
Yeah, I mean, if you're experiencing symptoms like these, shortness of breath, fainting, just having a hard time walking without just constantly stopping and catching, feeling tired, go see your doctor, because really that's the best way. Knowledge is power, as Dr. Kohli always says. So see your doctor, get diagnosed. You might have oHCM.
Yeah. And where are we going for more information, Dr. Kohli?
So Daren, you can talk to your doctor, but you can also read a ton at camzayas.com. There's lots of great information about obstructive HCM, its symptoms, as well as its treatments.
Well, I want to thank you both for sharing the story. And John, great to have you with us, and good to see that things are going well for you. Continue the pickleball journey as you've upgraded. I'll call it an upgrade again. Dr. Kohli, thank you so much for some much needed information.
Thanks for having us.
All righty.
Thank you so much.
Now, for more information, you can visit the website at camzyos.com. That's camzyos.com.